Hey guys, this is Dr. Chaffin. Just wanted to give you guys a little case here real quick. You can kind of see this case over here. This is a hybrid denture. This is a bar, acrylic denture teeth. It's 4 implants placed in a straight up and down position. Notice on this case here, looking at this area, you notice how much bone loss and stuff is around this patient's implants. Now that's really hugely extensive. You can also see some of the angulations on the initial placement could be completely improved. The thing on this case is pretty interesting is you want to take a look. What do you guys see there? 1, 2, 3, 4. This doctor perfed the underside of that jaw. That's kind of crazy too, huh? This patient, was actually told that this was a fixed prosthetic, and in actuality, this is a semi-fixed prosthetic. Okay, so I want you guys to take a look at these implants there. Okay, here's the 4th one. Now what I'm going to do is I'm going to kind of show you each of the implants. So on this particular one, down here, there is no facial bone whatsoever. It's just absolutely gone. And that's something that's a real problem. So what I want to do is I'm going to take you through. There's the next one. That whole facial plate is gone. And you go to the next one. And this whole facial plate is gone. You go to the next one here. That's pretty toasty as well. Okay, guys? So something that you want, a couple things you want to take from this is when you have a patient that has a semi-fixed prosthetic, you want to take it out at least every 4 to 6 months, depending on cleaning. Have it taken out, cleaned, and put it back in. When you also want to do your spacings like this, you want to probably go a little farther in the back here and here to gain support for this prosthetic. Or you do the no-bell technique, and you'll have a little bit better result. This is a really good example too. This was 4 implants placed up here and 1 failed, so now she has 3. So what we're gonna do in the upper arch is we're gonna lock it in with a hater bar to try to get and lock this in so the implants are enforced together. So the forces are not individually now, it'll be on a bar because I do not wanna lose these 3. This is a case right up in here that would go straight to zygomatics. Now here is a really challenging area. I have an oral surgeon going to be doing this because when you take these out that have failed, the bone is going to be super thin. It's going to have an oral surgeon rebuild that area. This is a great example of what happens to a patient when they're not advised to clean. She had been through multiple dentists that are too scared of taking this thing off, and they just said this is a fixed prosthetic. So those are some things that we can see from this interesting case. But another thing you can see is this case is now a really challenging case. So this is why it is a clear example of a failure hybrid. So if this patient was younger and the doctor had planed the bone down to get this stuff in, this is what happens after the fact when one of these cases fail. The case becomes triply as hard, and it's, a lot of surgery for the patients. As you can see, the upper arch will be becoming zygomatics. Down arch is going to be really challenging for any surgeon. So before you start removing bone, think about if you remove bone and the case fails, what's going to be the next step. So do case selection on these particular products. Another thing I've actually been told by doctors that I've seen is the difference is they understand that there's hybrid prosthetics and they understand there's denture prosthetics, but do not forget your bridge products. But in this case, this guy was a hybrid denture, no matter what the case was. But excellent case. You can kind of see this patient's in shambles. Okay, so these cases do fail. They're not long-term as everybody thinks. This is only a couple years. So we'll talk soon. I'll give you guys give you updates. All right, have a good week.